Okay, future HFAs. So before we can dive into Medicare reimbursement, Medicaid reimbursement, things like that, I want to take a moment and talk about what makes healthcare finance unique, what makes it different, what makes it more challenging. I also want to talk about the MDS assessment, the Minimal Data Set Assessment, and I think it provides a good foundation of where the reimbursement comes from. And it's probably something that is touched on briefly in your other courses, but I want to do a little more of a deep dive into it because it does impact reimbursement greatly. Okay, so the first thing I want to talk about is what makes healthcare finance different than finance in really any other industry. And there's a couple of things I want to unpack here. What's the goal of any business? Any business, from a coffee shop to a restaurant to a factory, they all need to make a reasonable profit. We have to stay in business. We have to keep the lights on. We have to continue to provide the service, whether that's a hospital, a nursing home, a home health agency, hospice, anything. Just because we're in healthcare, and even if we're a nonprofit, we still have to be able to keep the lights on. We have to pay our vendors. We have to afford to take care of our patients. So, in any business, and I'm a big fan of coffee shops. I drink way too much coffee. I always try to go local when I can. But for an oversimplistic example, let's compare what we do, what we're going to do in running a nursing home with a coffee shop. If you own a coffee shop, you want to make a reasonable profit, right? That's probably why you're in business. But what happens if one month you find that your coffee shop is losing money, meaning that basic business equation of your revenue less your expense is what you get, your profit. What if that doesn't work? What if your expenses are here and your revenue is here? You're losing money. Well, you'll make some changes, hopefully, right? Maybe you will charge more for your coffee. Maybe you will try to find ways of decreasing your cost. Maybe you'll find a different cup provider, maybe a different coffee provider. Um, that's a very oversimplified example, but you can see in a lot of other businesses that equation is a little simpler than in healthcare, right? If day one you walk into a new nursing home and you're the new administrator and your BOM comes to you and says, "Hey, we're losing money hand over fist. I don't know what to do." And you look at the books. Well, what can you do? Do you get to turn to Medicare and say, "Hey, Medicare, can you pay me more? I'm not making enough money." Do you get to go to the state and say, "Hey, state, I need more money for my Medicaid patients. Can you just pay me more so I can turn a profit?" No, doesn't work like that. Do a lot of the supplies that we have in healthcare are pretty complex, right? I mean, we have medications, we have therapy equipment, we have a lot going on. A lot of things that we are buying is very complex. You don't get to turn to your pharmacy and say, "Hey, can you just charge me less for these medications? I'm not making any money." You also don't get to just cut expenses. You don't get to just say, "We know we are just not going to buy gloves this month. We're just not going to provide our nursing staff with gloves, and we just can't afford it." You also don't get to cut down on your services, right? Um, Going to the basic example of a coffee shop, let's say you're losing money and you realize, "Hey, we're just not making any money on our baked goods. So we're just going to stop providing baked goods." You don't get to walk in a nursing home and say, "Hey, guys, I figured it out. We're going to just stop providing showers." Yep. And we're going to cut down to 2 meals a day, no snacks, no therapeutic diets, just the basic, we'll do brunch and dinner, call it good. We don't get to do that. That's an oversimplified example, but it's true. What you're going to manage in a nursing home, any healthcare provider, is going to be more difficult. And the financial side is even more difficult because it's a third party reimbursement system. You don't get to go most times to the consumer and say, pay me more. They have insurance, right? And you often don't get to go to the insurer and say, hey, pay me more. I need to make more money. And you don't get to cut expenses the way you can in other industries. So the business equation is a little more challenging. The second thing that makes healthcare finance more challenging is, what are we doing? Like, when you run a nursing home, what's your goal, right? Again, it's a very basic example, but let's look at the coffee shop. That coffee shop's goal is probably to provide the best coffee in town at a reasonable rate. Okay, so you walk into that nursing home day one, what's your goal? What's your product? Your product is varied, right? Overall, your product is care, but that care may be nursing care, therapy, social services, dietary. It's very diverse. And in addition to being diverse, how do you quantify that you're doing a good job? How do you quantify that we are providing quality, right? Most of us can go into a restaurant or a coffee shop or even a factory, and quality is pretty understandable, right? The general consumer can walk into a restaurant and know this is good food. I'll come back here. How do we define quality in healthcare, specifically nursing homes? How do you define quality? That is much, much harder in healthcare, because quality is very varied. Quality of care, quality of metrics. Are you doing well for the patients who have skin integrity issues? Are you doing well for patients who have physical therapy needs? Are you doing well for patients who have a lot of psychosocial needs? I mean, there's just a lot there. So, and I know I'm biased because this is the industry that I work in, but healthcare is very challenging, and healthcare finance is very different than finance in other industries. So, introduction to the MDS assessment. Uh, the next couple slides, we're going to get into what that is, but I want to give a quick background as to why I'm including this in the course. And it's because the MDS assessment is a critical part of how we get paid. And you can be a CPA, you can be a finance guy, you can be a CFO, you can be able to do extensive calculations in your head, whatever. It doesn't matter. That at the end of the day, how we get reimbursed and why we get reimbursed comes back to that MDS assessment. And it may be the nurse MDS coordinator who does the assessment, but as an administrator, you're going to want to know that assessment, what makes up that assessment, and you're going to want to know how it correlates to what you get paid, because the MDS assessment is an important tool in a nursing home. So the MDS assessment. MDS stands for minimum data set. It's a standardized assessment that every patient in the country has to have one. It is, if it's electronic now. It'll be through the EHR system your company uses, but if you were to print it, and we have a printed copy for your assignment in this module, it would be about 80 pages, and the MDS assessment is made up of mini assessments. And these mini assessments are categorized, like oral care, ADLs, ambulation. How do they ambulate from the bed to their chair, from their chair to the commode? How do they ambulate down the hall? Dietary needs. Do they have any therapeutic diet needs? Do they have restrictive diets? Diagnoses, nursing stuff, like what are their diagnoses? What are their medications? Social services. Do they have any behaviors? What do they have going on with their cognition? Are they able to recall certain words, certain events? Do they know the date? The MDS assessment encompasses every aspect of what nursing homes do for our patients. Now, the way I explain it, the best way I can think to explain it is, theoretically, if you were to take a patient's MDS and you were to study it and you were to know that MDS inside and out, theoretically, you should know that patient inside and out. Now, that's not saying that you can just manage off an MDS because it's only as good as the information that's put into it. And the person doing the MDS really needs to be able to be with that patient, know that patient, talk to that patient, know the information to do it accurately. But if someone hands you an accurate MDS assessment, that should tell you everything there is to know about that patient in your nursing home. So, how does the MDS impact reimbursement? Okay, so I can't overemphasize enough how impactful the MDS assessment is on your entire operations, especially reimbursement. Medicare, Medicaid, even private insurance like Humana, Cigna, UHC. Think about it. If the MDS is this summary of everything that you're doing for the patients, it directly correlates to how you get reimbursed, how much you get reimbursed, when you get reimbursed. So take Medicare, for example. How does Medicare know what to pay the nursing home? Well, that MDS has everything about that Medicare patient. It has why they're there. It has that they are a Medicare patient. It has their ADL scores. How well are they getting from the chair to the bed, or from the bed to the bathroom? How far are they walking? Their cognition, working with therapy. That and therapy notes combined creates this picture. And that picture of what you're doing for that patient can correlate to a score, and it's called a PDPM score. And we'll get into that in more detail in a later module. But it's that MDS that creates the PDPM score that then tells Medicare, based upon PT, OT, and speech, and nursing, and ancillaries, hey, this is what we're doing for the patient. This is how much we should get paid. Same thing for Medicaid. It's a little bit different. They're not PDPM, it's CMI. And again, CMI, case mix index score. We will get into this deeper in a later module, but it's similar. Remember, that MDS assessment will have everything about that patient, their cognition, how are they doing in psychosocial situations, activities, what's going on with that patient? Are they staying in their room all the time? Are they depressed? What is going on, right? Again, that MDS will correlate to a score. In the Medicaid, it's a CMI score. It doesn't directly impact reimbursement, but that CMI is a quantifiable number that aims to demonstrate the acuity of that Medicaid patient. What is going on with that patient? How sick are they? Therefore, how many resources are we using to take care of that patient? And again, it spits out a number. So 0.75, 1.3, something like that. You blend it all together, it correlates to one of the many variables that correlates to how you get reimbursed for Medicaid. So the MDS assessment, we'll go into it deeper when we get to the Medicare and Medicaid modules, but I can't overemphasize enough how important the MDS assessment is. Okay, so this is really interesting. How does the MDS assessment impact the perception of quality? If you've been around nursing homes at all, I'm sure you've heard of the Medicare 5-star rating system. If you've been around healthcare at all, I'm sure you've heard of quality metrics. Where do those come from, right? Think about it. How can we go to a website, or how can we go to data.medicare.gov, and we can see the short stay in-house acquired pressure ulcers for a nursing home in anywhere in the country, right? How can we see that? How can we quantify a star rating and say this nursing home does a lot better with anti-psych medication than that nursing home. Where do they get that information? The MDS. It's crazy to think about how impactful that assessment is to your operations. I know of a facility who did very, very well with their skin integrity. They had very, very few patients that had pressure ulcers at all, but they weren't managing the MDS process. So even though operationally they knew that, I think at the time, like one patient had an in-house acquired pressure ulcer, because they weren't managing the MDS assessment, they were actually scoring worse than state average because they had wounds that were marked on the MDS assessment that should have been healed. They had patients that came in with a pressure ulcer from the hospital or home health, wherever they came from, but because it wasn't marked in the MDS, that nursing home had to claim it, right? So then when the MDS coordinator submitted the MDSs, it was showing they had a lot worse skin integrity than they really did. And that is so impactful to your perception in the community. Like it or not, whether it's hotels or nursing homes or any type of rating system, we'd rather be a 5-star than a 1-star. And the MDS is one very important variable to manage that. Quality metrics is such an important thing right now in healthcare because we're getting paid based upon value, not volume. Trying to pay providers that do a good job. Well, how do you quantify good care, quality care? Well, you have to look at the metrics. Where do the metrics derive? From that MDS. Okay, so we briefly talked about the MDS assessment and its impact on reimbursement and its impact on quality metrics. As you can guess, it also is extremely impactful on your health inspection surveys. So, and think about it. If you're a surveyor and you have all these regs that you have to interpret based upon the interpretive guidelines, you go into a facility and you are doing a survey, what do you think is one of the most important things they're going to grab? They don't know your patients, right? They go to every nursing home in the state. They don't know your patients. They don't know your operations. They got to get to know them real quick. They look at your MDS. And it makes sense. If the MDS is supposed to be this big summary of every variable that's going on with that patient, like we said previously, theoretically, if you took a MDS assessment and you were somehow able to memorize all of it, theoretically you should be able to know a lot about that resident. So the surveyors look at MDS accuracy and they look at the timeliness of it because it is such an impactful thing on the operations of the facility. In the previous example of the nursing home who they thought they were doing very well with skin integrity, but they weren't managing the MDS process, not only was their 5-star reflecting more in-house acquired pressure ulcers than what they thought they had, guess what? When state came in, they got cited for MDS accuracy because they weren't accurate. So if you're a surveyor and you have to survey a nursing home with 100 residents, the MDS is going to be one of the most important tools you have to survey. So again, just like reimbursement, just like quality metrics, the MDS assessment is such a big part of health inspections. All right, guys. So one of your assignments for this module is going to be reviewing an MDS assessment. I actually have uploaded a blank MDS assessment, so you can print it. You can see how thick it is, how many questions are in there, and you can see how it's divided into areas like um, activities of daily living or cognition or dietary, what have you. And I'm going to ask you questions and you're going to have to go into it and find what section it's in and even answer some of those questions so you can kind of get a feel for what the MDS entails. All right, future healthcare leaders, that is all for this module. Please comment below. Let me know what your thoughts are. Let me know if there's a topic that maybe we need to cover that I can add to our coursework. Also, let me know if there's something that you think is maybe off base and we need to change up. Until next time, I'm Brody 09s.